Hi everyone, Dr. Kalaiko here. I'm here to talk about the COVID-19 vaccines. So I have some exciting news. Some of our community pharmacies are now able to give the vaccine to our healthcare workers in the community. So if you recall, the CDC has determined that healthcare workers and people who live in nursing homes are at highest risk for having severe disease from COVID-19, and so they have been prioritized as the first group to receive the vaccine. So I actually received my vaccine just yesterday, and I wanted to share with you how I'm feeling and how it's going so that you have an idea of what to expect when it's your turn to get the vaccine. So for me, probably within 3 or 4 hours or so of getting the vaccine, I noticed that my arm started to feel pretty sore. And by evening time, it was significantly sore to the point where I couldn't lift my arm beyond maybe about this point or so. So there was some significant kind of pain and soreness in this area where I received the shot. And for me, it was similar to when I got the tetanus, diphtheria, and pertussis vaccine, or the Tdap vaccine, a few years ago. Other than that, I also noticed that I was feeling a little bit more tired than usual yesterday night, and so that may or may not be related to the vaccine. I did have a long day at work yesterday as we were giving out a lot of vaccines. It was our first day giving the vaccine, so it was a busy day also. So I was generally a little bit more tired, but today I'm feeling okay, energy-wise, pretty normal. And the soreness is definitely still there. So I've taken a Tylenol, and so I expect within the next few hours, I might have a little bit better range of motion on my arm. Other than that, I'm feeling great overall so far, and I'll check in with you again later in the week to give you some updates on how I'm doing. Side effect wise, most people, almost everybody will feel that soreness in their arm, and it may take a day to develop, and it usually lasts maybe a day or two. Some other people might feel, like I was mentioning, some fatigue. Others might feel maybe a headache, even some body aches is possible as well. All of these are pretty normal and expected side effects with the vaccine and with many other vaccines as well. So it's simply a sign that your immune system is responding appropriately to the vaccine. It's nothing to be alarmed about. It's not that you've gotten COVID from the vaccine, because that is actually not possible. So in the vaccine, what it contains is an mRNA molecule. It does not contain the virus itself. It does not have any live COVID virus in it. An mRNA molecule is basically instructions for your muscle cell to create the protein that looks a lot like the protein that goes on the outside of the coronavirus, those little spiky things. And so what happens is your muscle cell will take those instructions, it'll make the protein, and then it will tell your immune system, here's what the protein looks like. Your immune system will then recognize that protein. So if you do get exposed to actual COVID in the community or wherever it is that you go, that your immune system will be able to recognize that and attack the virus and kill it. So that's how it works in a nutshell. So it's impossible to get COVID from the vaccine itself. There are some news reports that some people have had some allergic reactions to the vaccines, and sometimes those reactions can get very serious. It's important to know that having a serious allergic reaction to the vaccine is still very rare. That means it doesn't happen very often. But it is still a precaution after you get the vaccine that you wait around in the pharmacy or wherever you get the vaccine for about 15 minutes, just so the pharmacist can, or the healthcare professional can observe you and make sure that you're feeling well. If you're not and you start feeling ill, you need to let them know right away. And there are protocols in place at each facility to make sure that they can treat you appropriately. I've already talked about the allocation. At this point, it's pretty much only healthcare workers and people living in nursing homes that are able to get the vaccine. But as the supplies increase, then we will be able to vaccinate more people in the community. And these are prioritized according to the CDC allocation rules. Lastly, I just want to wish everybody well. So continue to wear your masks, avoid crowds, and practice that social distancing. Wash your hands frequently, and we can do this together. You know, once it's your turn to get the vaccine, that is just one more tool, and a very effective tool in finally ending this pandemic once and for all. Thank you.